Just to say that if you're interested, SOAP relates to an intervention with nursery nurses and about upskilling their abilities. For those of you who may know Henry is an early health and nutrition program about trying to reduce childhood obesity. And Bright is a study which is run by Zoe Marshman and Nicola Innes up in Dundee. And that's around supporting adolescents through text messaging and reminding them to toothbrush. So these are all different types of resources for different healthcare professionals to try and support these behaviours at home. I'm just going to talk very briefly. When we were approached by Oral-B, they said, we'd like to develop something for the dental team. And you'll see that these packs are here, and we'll talk a little bit more about those in the second session. But when they came and asked us about it, we said, well, we need to do a little bit more work. We need to do some more work on what's out there in the not just concentrating on our initial systematic review, which was around toothbrushing for the 0 to 7s, but we wanted to look at diet, and we also wanted to look at the children aged 7 to 11. And that brought in some key findings that these barriers track not just up to 0 to 7, they don't just stick in the toothbrushing, but healthy eating and toothbrushing 7 to 11 also have a wide range of barriers. It's not just around knowledge. We did some more qualitative interviews with dental teams and parents about those oral health conversations. So that was very interesting. It was really fascinating to go into dental practices which are really supportive and keen to deliver oral health. And almost you there, and it was a team effort that as soon as you walked in, the nurse, the receptionist might start a conversation off, or if you're looking at a poster or something, they might take that conversation. The nurse would almost pick it up, and then you'd have your conversation in the dental setting, and then it would almost work its way back out. So the whole team are buying into it. And I think that's very different to some of the dental settings I've worked in, where some poor person is left in the surgery to do the oral health conversation and everybody else ignores it. I think these teams where they really embrace oral health are really important and critical. They acknowledge that some of the challenges of working with the NHS, but they did want resources which were colourful and engaging. And so we worked with the Oral-B on that. We then developed the resources and then took them out over 12 different workshops across Lancashire and Yorkshire and really gave them a thorough road testing to make sure they were what dental teams worked. And if I just summarise, these were approximately some of the findings. They wanted the examples of good oral health and poor oral health to be brought together, and that importance about parents need to take responsibility. The messages need to be clear and consistent so that all the team members were delivering it from the same point of view and consistently. And it was communicated to all caregivers. That wasn't just the parent who brought the child, but trying to get to the wider audience and making sure the grandparents and others. And they wanted it fun and engaging. As Cara said, it's around a structured conversation. We'll talk a little bit more about that in the second session. But it's hierarchical. Let's concentrate on the motivation first. And only if those are motivated, then we talk about how to undertake those behaviours. Address the different barriers, so multiple barriers are addressed. Acknowledging the wider family and the busy lives we live in. And so this is the pack and the resources that are here. But as Cara said, it's about the conversation you have and how can we improve the conversation. These are just some resources to support that. But the resources are based around supporting that whole dental team and making sure there's a clear and consistent message across the whole dental team. It's around a structured conversation, and we'll talk a lot more about that in the second session. And resources addressed the different barriers, both paper-based, they're video-based, and they're coming out very soon, and there's also digital copies as well. So they're around trying to help you in that dental setting in whichever media you want to talk about it and whichever way you feel most comfortable about it. And the resources and the conversations we're going to have in the second session, we have to acknowledge both Oral-B, and that's one of their manuals on how to use the strong teeth pack, but also Health Education England with regards to the development of Module 4 and 5 and some of these wider structured conversations. And so Lucy's just going to very briefly touch on some of the communication skills, and then we're very much going to wrap up this session and leave you with a little exercise just to finish this off.